Hi, my name is Tori, and I am doing my video today on redirected phonation. So, redirected phonation therapy approach can be used on children or adults. Typically, these individuals have difficulty finding their voice. Most often, these individuals will have aphonia or dysphonia. So the population is adults or children, so all ages covers all ages. And the steps for this treatment approach include coughing, gargling, humming, laughing, playing the kazoo or the comb, singing, throat clearing, trilling, and then phonating. So it's been said that if an individual can voice one of these steps, that they are more than likely be able to redirect the phonation to produce a speaking voice. So if I was with a client right now, I would use a recorder or a microphone. So I would just probably use my phone. And so this serves as the client's voice model for this therapy approach. So it's super beneficial to have a microphone or recorder on hand so the client can hear back what they produced. And sometimes when you hear it yourself, you better understand where the clinician is coming from. So the first step is coughing. So this allows the client to determine, this allows the clinicians to determine what treatment approaches and kind of what alleyways the clinician should go about that will help discover the client's voice. So the first step is you cough 2 times, and then after doing that and hearing yourself back on the recorder, you add a vowel. So for example, you go and then I would record that so my client could hear them cough, and then after that you add a vowel. So you go E, E. So the second step is gargling. In this step, the voice is prolonged, so it generally produces phonation overall. So the client is instructed to gargle water for 5 seconds. And then after doing that, they will gargle it again, but they're going to make that k sound. So for example, and then after that, they're instructed to make a kind of like a dry gargle with a K sound. So and this also, in addition, gets those vocal folds moving, which we want because, as we know, vocal folds have to move to create phonation. So the third step is humming. The client is instructed to hum a familiar song. This develops a voice with less disturbance, and it's kind of used as a target in voice therapy. And this is honestly the best way to have a patient find their best voice, which is important. So, for example, I would have the client hum Happy Birthday or Sweet Caroline or any familiar song that they would know. So, for example, they would say, and so on. And as you can see, the pitch also changes within those songs, which is also beneficial for the client as well. So the fourth step is laughing. This is a really good step to discuss pitch, loudness, and quality. And this is when the recorder really comes into play because the client is instructed to laugh in a recorder, and so the clinician should play the recording back to the client so the client is more aware of their pitch, loudness, and overall quality. So spontaneous laughter is typically relaxed, and this can provide a contrast to a hyper-functional voice that can help overall in general and help overall body tension as well. So I would give a client my recorder and I would record her or him laughing. So for example, the client would do and the clinician would measure that quality and pitch and laughter and see if it is accurate and where it should be. So the fifth step is where the client plays a kazoo or a comb. I do not have one, so I can use this as an example. So this step is used to produce voice while playing a kazoo. So it allows for vocal fold vibration and for voicing, which is really beneficial as well. The patient is instructed to say nasal word sounds such as Nancy, name, nice, those kinds of sounds. And the main goal for this is to see if there's any nasal emission. So if the sounds are sounding how they should, and I believe at a comb there's a little bit of a balloon, I think, that blows up if their nasality is not where it should be, if it's hypernasal or hyponasal. But for example, the client would put it up to his nose and they would say 9, Nancy, and nice. So the sixth step is singing, and this is when the clinician directs the client to convey a message while singing. So this kind of redirects a speaking voice phonation, and it improves breath control as well. So the main goal is to stop the singing, but the singing is a very good place to start when redirecting the phonation. So for example, the clinician could have the client say, "My name is Tori." And overall, the singing will help the phonation, and, hopefully throughout therapy, the singing will stop and more of a speaking voice will appear. The seventh step is throat clearing. This is when the clinician wants the client to kind of fluctuate their voice as we clear our throats. So for example, we would have the client do So as you can see, the pitch changed, the quality kind of changed, the loudness changed. And this really is beneficial because it vibrates the vocal folds, which, again, as we know, the vocal folds have to be moving properly in order to phonate certain sounds. The eighth step is trilling. This step is often kind of difficult for some clients because a lot of clinicians want the client to trill their R's, which is very beneficial. I don't even think I can do it, but I will try. This step is beneficial because it helps them develop a better voice overall. It jumpstarts the vibration of the vocal folds and allows them to produce their best sounding voice. So for example, the clinician would want the client to trill the R, such as "Rrrr," and do that a couple times and record themselves, and then the clinician can play it back so the client can hear their progress they are making. The ninth and final step of redirected phonation is the step. So this focuses on redirecting a patient's utterance into an easy speaking voice. So the clinician directs the client to do changing in pitch, and then adding words after, many, Nancy. And the last step of this step requires proper breath control, so you sitting up properly and having that open respiratory area available, and saying all of this in one breath. So, many, Nancy. So again, this redirected phonation is extremely beneficial because it helps children and adults with aphonia and dysphonia generally help find their voice. I really liked this approach, and I will definitely be using it with my future clients. So thank you. Hope you enjoyed it.